The primary objective of this part of the study was to look at the efficacy of what we call veliparib throughout, which would be giving veliparib with combination chemotherapy followed by veliparib maintenance. And the control arm was, as I mentioned before, will be the combination chemotherapy with placebo followed by placebo throughout. So in this particular analysis, we set up the primary endpoint to be progression-free survival for that arm versus the control. And the way that we set this analysis up is that we were very interested in looking at the efficacy of this combination in 3 distinct populations, each one being inclusive of the previous. So the first population were those patients that were defined by a BRCA mutation. And in this study, we were able to evaluate both germline and tissue-based or somatic mutations in BRCA, and that comprised one whole group. And that was, about 200 patients. We have a second group that we called HRD, homologous recombination deficient, and this included those 200 patients that were BRCA positive or carried a BRCA mutation or had one in the tumor, because those are essentially homologous recombination deficient. But then we added the patients that were wild type for BRCA but had homologous recombination deficiency, and we did that through an assessment of an assay assessing for HRD. And that was about 421 patients total. And then the third inclusive patient population is the entire patient population, and that totaled 757 patients. So the primary endpoint was to look at progression-free survival in the combination arm with veliparib be given throughout versus the placebo arm. And what we found was that in each of those patient cohort groups, the addition of veliparib improved the progression-free survival significantly.